Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak again with Professor Andy Pekos about the latest news on the Omicron variant. Let's listen. Dr. Pekos, it's great to have you back on the podcast. We're going to talk about Omicron again. What do we know from the last week?
Well, as you might expect, almost on an hourly basis, we're getting updates on certain aspects of the Omicron outbreak. I think one thing that's becoming very clear with data out of South Africa and parts of Europe in particular, that this virus really is spreading quite effectively in populations. It's spreading in two different kinds of scenarios. In South Africa, there was very low amounts of COVID-19, and it seems to have sparked a surge of cases in many provinces there. And in Europe, where Delta was already well established, it also seems to be spreading at a fairly high rate. And estimates are that it's spreading at a rate that's equal to Delta, if not a little bit better. So it seems to be a virus that's able to transmit among individuals fairly effectively.
Now, what do we know about its ability to transmit among people who've had a prior COVID infection or have been vaccinated?
Yeah, so this is, again, data that's primarily driven by South Africa, but we're also seeing evidence of this in the travel-associated cases. There seems to be a large number of individuals who are Omicron infected that have been vaccinated previously, including individuals who have been boosted. And in South Africa, they've done an analysis of their initial cases and shown that the risk of reinfection with Omicron is almost 3 times greater than it was with previous variants, including the Beta variant and the Delta variant. So much as we would have predicted from the sequence, it does seem that this virus is able to evade some of the vaccine-induced and infection-induced immune responses, and at least is able to establish an infection.
So that is not great news, I would say, and maybe predicts that we'll see more infections from this variant in the near future around the world.
I think that's probably true. What we're really waiting for is the data on disease severity. And, unfortunately, disease severity lags behind infection and reporting of cases because, it takes about 10 to 14 days before people develop the really severe form of COVID-19 if they develop it. So, this week and next week, we'll start to see data on hospitalization rates, and we'll be able to see how those hospitalization rates are moving with respect to the case rates in different countries. One positive aspect of it, again, coming from South Africa, got to give them credit for just continuing to provide data globally at an incredibly fast rate. There are several reports from South Africa now that suggest that the disease that they're seeing there is relatively mild. And again, we'll need more data to confirm that, but at least that's one good thing that's coming from the data that we've seen in the last week.
I've seen some reports that perhaps the patients aren't as likely to need oxygen or maybe don't spend as long a time in the hospital as previous waves. Is that what you're referring to?
Yeah, absolutely. There was one report from South Africa that really sort of indicated that they found some COVID-19 cases just because they were looking, not because these individuals were in the hospital and showing symptoms of COVID-19. People were in the hospital for other reasons and ended up being COVID-19 positive and aren't showing the typical signs of severe COVID-19 that South African hospitals have seen previously.
And they had the Omicron variant.
Yes. Many parts of the world are going to be reporting data faster than you may see here in the US because they have this particular PCR test that gives a signature that is apparently very Omicron specific. So it's not a specific PCR for Omicron, but the signature Omicron gives is unique to it. And so you'll see some of that data coming out faster from other parts of the country because they don't have to rely on sequencing of viruses to confirm an Omicron infection.
And what's the status right now of this variant in the United States?
We've seen many travel-associated cases, and there's significant community spread in almost every instance I've seen where there have been a documented travel-associated spread. We're seeing several reports of what we call super spreader events, meaning that one individual is apparently infected 5, 6, 7, 8 other individuals at one event. So it's showing all the signs that we saw with Delta and with Alpha that spread and transmission can occur quite efficiently with this variant.
Now, I know there have been some plans to study the antibodies that are generated by the vaccine against the new variant. What's the status of those studies?
So several of the vaccine manufacturers have been able to generate what's called a pseudo-neutralization assay. And that's an assay where they put the spike protein of a variant into a different virus, and that allows them to very quickly be able to assess antibody reactivity data. We don't know the results from that yet, but we know that those studies are ongoing. So that'll tell us from these companies' banks of serum from vaccinated people how well they recognize the spike protein from Omicron. And then personally, I know of a dozen laboratories that are trying to isolate the virus and distribute it both nationally and globally so we can study more aspects of the virus itself and what may be going on that is mediating this transmission efficiency that it appears to have.
Let's talk about what results we might expect from these neutralization assays. We may find, for example, that the response is different for Omicron compared to Delta, but will that necessarily translate to the implications for how sick people who are vaccinated will be? What do you expect that conversation to look like?
Well, based on the sequence, I would certainly expect that this virus will evade some of the vaccine or infection-induced antibody responses. It won't eliminate all of it. And so it'll be really important for us to understand if it doesn't induce severe disease, what aspect of that vaccine-induced immune response is really providing some level of protection. We've seen with the Delta variant that the vaccines can protect against severe disease much better than they can protect against infection. And what we hope to see with this variant, Omicron, is a similar thing, that we're seeing antibody responses that would normally protect from infection be a little bit reduced, but the ones that are protecting from severe disease will be maintained. That's the ideal scenario, and the one that I would expect to see given data with other viruses like influenza.
Got it. Final question for you today, and I'm sure we'll be checking back in with you as more of this data comes in. I'm noticing that you say Omicron and I say Omicron.
English-speaking languages have butchered the Greek alphabet pronunciation for many, many centuries. So I think it's all the same at the end of the day. But certainly I think there are some linguistics people who will be very particular about their pronunciation.
Well, I wish we could call the whole thing off, but I'm not sure we can. Anyway.
I agree with you.
All right. Thanks so much, Dr. Pekos. Talk to you soon.
Thanks for having me.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.